my name is Shawn Taylor. I am a pharmacist and a professor of pharmacy at Wingate University in Hendersonville, North Carolina. I practice in the field of diabetes. I am a certified diabetes educator, and I see patients at Park Ridge Health Endocrinology. So in this video, we're going to focus on what is type 2 diabetes. And so most people have heard that diabetes is a high blood sugar level. But a little further back from that, what actually causes diabetes? And I have the two reasons listed here about what leads to that high blood sugar or that elevated blood glucose. And those two things would be a lack of insulin production, or that the insulin that you are producing is not working as well as maybe it used to. And so to kind of make this a simpler analogy, let's think about insulin like a car. And so every time that you are eating, and most specifically carbohydrates or foods that have sugar, and we'll talk about those a little later on, what happens is your blood sugar rises. So in response to that, our bodies are very receptive and they start producing insulin. The insulin, remember, is like our little car. So it goes into your bloodstream, it picks up all of that extra sugar, and it takes it and it stores it in a variety of places in your body. So one example would be your muscles. And so then maybe a couple hours later, you're going to do some physical activity, and that stored insulin is now able to come out of those muscles and you're able to use it up. But what can happen over time is if you do consume a lot of carbohydrates or a lot of sugar, that insulin has to work harder and harder to try to keep up. And it does a pretty good job for a long time of having enough insulin in your body to pick up all that sugar and to store it. But just like a car, as we mentioned before, it's probably not going to work as well 20 years later, 30 years later. Just like a car is going to function a little bit differently the day you drive it off the lot brand new and then 20 years down the road. And so what can happen is then you don't have enough insulin to pick up that sugar. And so the sugar is just staying in your bloodstream now, and that can lead to complications related to diabetes. So one way that you can prevent diabetes, or you can even treat diabetes, even if you're on medications already, is through changes in your diet. Exercise has a big impact as well on how well your blood sugar is controlled or preventing diabetes, but the diet actually has the biggest impact. So to understand the ways that you can change your diet and modify it to prevent developing diabetes or to treat it if you already have it, is to first understand what a carbohydrate is. So a carbohydrate is this big molecule with a lot of sugars stuck together. And what happens essentially as soon as we eat is our body breaks those carbohydrates down and they become sugar. And so that's the same sugar that, if you don't have enough insulin, is getting left over in your bloodstream. And so there's three big sources that I think of that contain carbohydrates. The first one is starches. So that's going to be potatoes, pasta, rice, bread, cereal, even corn. Even though we think of corn as a vegetable, it's actually a starch. The second is going to be the sweet things. And these are the ones that probably come to mind if you think about things that cause diabetes. So that would be candy bars, cookies, pies, any kind of dessert type items. And then the last one is one that we forget about sometimes, and that's drinks. And so I don't mean diet sodas, but regular soda products that have sugar, fruit juices, even some of our energy drinks or vitamin type waters and things contain a lot of carbohydrates. And so these are the three main types of foods that you have to work on reducing in order to help either treat the diabetes or to prevent developing diabetes.